Welcome to Real Hope, a monthly video series by the Mississippi Department of Mental Health to share more about specific services and supports that are available in our state to help our friends, family members, and neighbors who have a mental illness, substance use disorder, or intellectual or developmental disability. Each month in our Real Hope series, we will dive a little deeper into a specific service or support. This month, we will hear from Dr. Thomas Recore, VMH Medical Director, as he highlights forensic services.
I'm an Ocean Springs native. After my chief resident year in 2015, went to University of North Carolina for forensic fellowship. 6 or 8 months ago, was asked to be the first full-time medical director for the Department of Mental Health. I think the best way to describe what we do in forensic services is you think of 3 different domains of forensic services patients: the folks getting evaluated for competence, the folks being sent for competence restoration, and the continued treatment forensic folks, including the irrestorable and insanity acquittees.
VMH's approach to forensic services focuses on rehabilitation, risk assessment, and individualized care plans that promote recovery and reintegration into society when possible.
The United States Supreme Court says that folks have to be physically and mentally present. For folks that are experiencing symptoms of psychosis, they are prescribed medications that treat those symptoms. For some people, they can't be restored to competence to proceed legally. If a person can never be restored to competence, they can never face their legal charges. There's a legal premise known as sanity. Insanity has to do with whether someone knew the nature, quality, and wrongfulness of their actions at the time of an offense, and that defendant ended up harming the person. This defendant would be found insane, and those folks, by law, are sent to state hospital for continued treatment. This is where I think the intersection of the criminal justice system and the mental health system really play an important role. 70% of folks who get incarcerated will come back to the criminal justice system within 5 years. I think if we can refer people to the services they need, so get people with serious mental illness sufficient treatment, get folks with substance use disorders properly situated and involved in treatment, we can actually reduce that recidivism piece, which fundamentally makes our communities safer places to live. Mississippi, like just about every other state, has had challenges in terms of its provision of forensic mental health resources. Cliff Johnson and the folks at MacArthur came and visited. Cliff did a good job, I think, bringing together stakeholders like law enforcement, the courts, the folks in the Department of Mental Health. When I came back to Mississippi in 2016, we had 35 total beds in all of Mississippi for any forensic-related thing. You know, most people know that we're opening a maximum security building at Whitfield shortly, so, ribbon cutting any day now. We've done a really good job building out other resources so that when people are ready to go to that next level, it's not a major step down from maximum security to no security. It's maximum to medium low to low security to, at some point, we'll move to forensic group home with court supervision, all of those pieces. And so really from my perspective, we're entering a time in Mississippi of really having an ability to demonstrate getting it right, where the folks in the Department of Mental Health who are called to be of benefit to people who are suffering with serious mental illness and advocates for the well-being of people, and the disability rights folks, and the folks in the legislature, and law enforcement folks are all working together to address this need. I think there's something that will emerge from this that's transcendent, frankly.
By making more people aware of the resources available in Mississippi, we can ensure that more stories of resiliency and recovery are created each day.